everyone. Thank you for allowing me to present today on the clinical effects of air pollution in Ireland. This is part of my doctorate from RCSI, which I completed in May 2021. So as an introduction, in terms of the historical context, this has been an issue since Roman times, and the first Clean Air Act was actually in Constantinople during Roman times. But it became a particular issue during the Industrial Revolution and also due to domestic fuel burning as well. And then the advent of the motor car in the 20th century aggravated things. In terms of the, I suppose, cultural zeitgeist, the Great Smog event of 1952 in London was a particularly key event in terms of getting it into the public consciousness. And it's estimated during that event that 3,000 people died due to air pollution in London. And if anyone watches The Crown, it's been immortalized on that show where Queen Elizabeth talks about that. And that instigated the Clean Air Act in London and in the UK in 1956. We've been a little bit behind the times here, but we did instigate the smoky coal ban in 1990 in Dublin, and that extended around the country since then. And that ban led to this probably the seminal paper on death rates and air pollution by Dr. Clancy and others, which showed that there was a reduction in cardiovascular deaths and respiratory deaths due to the smoky coal ban in Dublin, and it's estimated now that 8,000 people have lives have been saved due to that measure. So I don't need to talk to you about the various different sources. Just to highlight that residential and transport are the main sources of air pollution in Ireland, and that's primarily particulate matter, nitrogen oxides and sulfur dioxides. In terms of the pathogenic mechanisms, though, from a cardiovascular point of view, there are a few different mechanisms that air pollution causes systemic effects and disease in the body. There's firstly direct effects to the lung, where it can cause inflammation in the lung, and this inflammation can spill over into the system and cause cardiovascular disease that way and other diseases. The particulate matter can actually cross the lung-blood barrier and enter the bloodstream, and then have direct effects on organs such as the liver, the brain, vascular arteries, and so on, and cause direct action there. And it can also directly cross into the central nervous system as well via the olfactory nerve, and cause problems with your autonomic nervous system, which is the part of your nervous system that controls your blood pressure, your heart rate, and so on, and can cause acute effects there. And their effects that happen acutely, and then in the chronic exposure, it can also increase insulin resistance, can increase glucose levels and cause diabetes, can cause obesity, vascular dysfunction, hypertension, and the deposition of plaque in blood vessels. It's estimated in the EU that from 2018 that there's 452,000 premature deaths due to air pollution in Europe. In Ireland, it's estimated that about 1,410 premature deaths occurred due to air pollution in Ireland. And I suppose what are the clinical effects of air pollution? Well, firstly, there's an association with overall mortality and impacts on mortality due to air pollution. This is a study that was published in New England Journal of Medicine in 2019, which looked across the globe at about 650 cities and daily mortality due to air pollution. The interesting part of this is that the clinical effects of air pollution were greatest at the lowest particulate matter levels. So the steepest curve impact was at the lowest levels, below levels that were previously considered safe by the WHO and the EU, which shows that nowhere can be complacent about the effects of air pollution, and even in a low pollution country like Ireland, that there are clinical effects being seen due to the air pollution in here. There's also cardiovascular effects, such as diseases like atrial fibrillation, heart attacks, blood pressure, carotid disease, and so on. In terms of stroke, there are long-term and short-term impacts. The association is probably greater with ischemic strokes, strokes due to blood clots, rather than bleeds in the brain. But there are certainly associations with both. There's obviously respiratory impacts as well, with asthma, COPD, and even COVID being associated with air pollution. Neurodegenerative diseases such as dementia and Parkinson's disease have also been associated with air pollution. And other diseases such as rheumatoid arthritis or diabetes or chronic kidney disease have also been associated. In Ireland, one study looked at TILDA data, which is longitudinal study of aging, that's led out by Prof. Kenny, and it showed that indoor particulate air pollution from open fires, exposure to that decreased your cognitive function over time as you got older. And in this study, they found levels of air pollution in people's homes that were similar to standing beside a heavy traffic roadside. So it's interesting to see some Irish data showing that there is impacts on people's cognition due to air pollution. The particular parts of the particulate matter were magnetite nanoparticles, and these were predominant in that study. These nanoparticles have been found even on autopsy of young children who have been exposed to air pollution. And this is a study out of Mexico, which looked at cadaveric dissections of brains of young children, and they found magnetite pollution particles in parts of the brain that are associated with dementia and Parkinson's disease, showing that the lifelong effects of these exposures to air pollution. So it's interesting to see the long-term effect that these exposures can have. So our study, we specifically looked at the short-term risk of stroke from air pollution. We picked this for a few different reasons, but mainly because it hadn't been looked at before in Ireland. The geographical distribution, when I looked at the previous research that had been performed, a lot of the positive studies were from China, from US, and from continental Europe. There were very few studies, positive studies in the UK, and no studies previously performed in Ireland on short-term risk of stroke from air pollution. I suppose it raised the question: is there a threshold that you have to reach to have a short-term risk of stroke from air pollution, as the UK has lower air pollution levels than other countries? Also, the different subtypes as well, as I mentioned earlier, whether it's caused by a clot or whether it's caused by a bleed, There's certainly stronger evidence from the literature that for ischemic stroke, but not as strong for hemorrhagic stroke. There's also the impact of seasonality and temperature, whether there's temperature effects or whether it's to do with different heating systems, such as solid fuels and so on. And then there are two major study types that looked at this question: time series analysis and case crossover studies. So we planned to do both. So our hypothesis was that outdoor air pollution is a risk factor in short-term risk of stroke in a relatively low pollution country such as Ireland. As I mentioned before, it hadn't been examined before here, and in studies in countries with low levels of air pollution, they were more equivocal than countries that had higher levels of air pollution. And then we utilized the two main study methodologies as well. So this time series analysis was published last year in cerebrovascular diseases. We looked at Dublin and Cork on a county level basis. This was due to the availability of the data set, which we used HYPE data, or hospital inpatient data. So they coded at county level. So that was as granular as we could get. We used an average of the monitors across both counties to calculate pollution levels on each day. As mentioned, it was a time series analysis. We used Poisson regression. We used splines for temperature, for relative humidity, as these were accounted what other studies accounted for previously. We also took into account day of the week, as there is variation on stroke admission by day of the week, with lower admission levels at the weekends, and also took into account public holidays as well for the same reason. We used a lag of 0 to 2 days. Again, this was the standard lag that was used in the literature, so a 72-hour period we looked at. We looked at seasonal analysis, and then we did various different sensitivity analyses as well, adjusting splines and using negative binomial regression as well for analysis. So these are the baseline characteristics. I won't hang on this too much, but just to show that it confirms that the low levels of air pollution relative to other studies. So PM 2.5 levels and mean levels in Dublin were 8.7. Similarly in Cork was 7.7. And numbers of strokes, so it was about 6 per day in Dublin and about 2.4 per day in Cork. And of those, 4 were ischemic strokes in Dublin and 1.8 were ischemic strokes in Cork. So on analysis, we looked at Dublin and Cork separately, and then we performed a meta-analysis to look at both together. When we looked at the overall time period from 2013 to 2017, there was no significant difference in the two groups in terms of exposure. But when we looked at the seasonal analysis, there was a significant difference found. So there was a significant association found between all types of stroke and NO2 exposure in Dublin. And that was statistically significant. Similarly for stroke and PM10 in Dublin. And then on for PM 2.5 and all strokes and ischemic strokes, there was a significant association found in Dublin, and then on meta-analysis as well of the two areas. So in winter, we found that PM 2.5 and NO2 was associated with all stroke, and PM 2.5 with ischemic stroke at a lag of 0 to 2 days. It was the first UK or Ireland study to demonstrate a positive association with these. The sources were likely domestic wood and peat burning based on previous analysis studies that have been performed in Ireland, showing that the spikes of pollution in Ireland are due to domestic wood and peat burning, and supports a national ban on solid fuel burning in Ireland. As mentioned, it's the first such study in Ireland, and it has international implications as due to the relatively low levels of air pollution that are in Ireland. There are some limitations. Obviously, we use county level data, which is obviously very broad strokes and doesn't get down to individual, may not estimate correctly individual exposure. It was an ecological time series as well. Individual confounders couldn't be taken into account. However, levels of things like smoking, hypertension, and so on shouldn't change over the course of the 3 days that we would be looking at this. So I don't think that it should have too significant an effect on what we can draw from this. The concentration of monitors in urban areas is certainly an issue, especially in Cork. At the time, all the monitors were in Cork City. There weren't any in Cork County. There's, as I mentioned, a kind of a uniform exposure assumption, and that these implications actually may mean that the effect is we underestimate the effect of air pollution in Ireland rather than overestimate the effect. And then just statistically, because we did use robust standard errors, but we couldn't adjust fully for clustering due to the nature of the study. So I'm just going to quickly mention some unpublished data we have where we looked at a case crossover study as well. We looked at Beaumont catchment area. There were only 2 monitors in there looking at NO2 and PM 2.5 in ozone. But we used stroke audit data from Beaumont to more accurately assess when people have had a stroke, using similar processes to the previous study. And just to quickly say that there was an association across all the time periods between PM 2.5 and ischemic strokes in the study time period. Just to briefly discuss, these studies were the first UK and Ireland studies to demonstrate an effect on air pollution on short-term stroke risk, specifically PM 2.5 and NO2. The association was mainly with ischemic stroke, not hemorrhagic stroke, and it was in a low pollution country. So it does support traffic reduction measures and a solid fuel ban. And also, I suppose, it's interesting that the WHO have now lowered their guidelines for daily and for annual pollution exposures due to the multitude of studies that have shown the clinical effects of air pollution at lower air quality levels. And just interesting to say that in Dublin, in particular, but across the country, many of our urban areas are going to be affected by these WHO recommendations and fall breach of WHO recommended levels for both NO2 and for PM 2.5. So thank you very much.